Endacof-Dm is a combination medication used to treat symptoms caused by the common cold, flu, allergies, hay fever, or other breathing illnesses such as sinusitis and bronchitis. The medication contains dextromethorphan, which is a cough suppressant that reduces the urge to cough, decongestants to relieve stuffy nose symptoms, and antihistamines to relieve watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. It is important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years. It is also recommended not to use this product to treat cold symptoms in children younger than 6 years unless specifically directed by a doctor. Additionally, certain products such as long-acting tablets/capsules are not recommended for use in children younger than 12 years. It is important to ask your doctor or pharmacist for more details about using the product safely. Endacof-Dm does not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk of serious side effects, it is important to carefully follow all dosage directions and avoid using the product to make a child sleepy. It is also important to avoid giving other cough and cold medication that might contain the same or similar ingredients. It is recommended to ask the doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drops/spray. When taking Endacof-Dm, it's important to follow the directions on the product package or as directed by your doctor. Take it by mouth with a full glass of water, with or without food. If using the liquid form, be sure to measure the prescribed dose carefully with a medication measuring device. Do not use a household spoon. If taking the extended-release capsules, swallow them whole and do not crush or chew them. Chewable forms should be chewed thoroughly before swallowing. The dosage of Endacof-Dm is based on your age, medical condition, and response to therapy. If you are taking it for allergy or hay fever symptoms, take it regularly to get the most benefit from it. It's important not to misuse this medication, as it can result in serious harm. Do not increase your dose, take it more often, or use it for a longer time than directed. If your condition lasts or gets worse, be sure to consult your doctor. Some common side effects of Endacof-Dm may include drowsiness, dizziness, headache, upset stomach, nausea, constipation, or dry mouth/nose/throat. To relieve dry mouth, you can suck on sugarless, hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. It's important to drink plenty of fluids unless otherwise directed by your doctor, as this medication can dry up and thicken mucus in your lungs. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. Remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. However, if you experience any serious side effects, such as mental/mood changes, shaking, trouble urinating, weakness, fast/slow/irregular heartbeat, or trouble breathing, be sure to inform your doctor immediately. In rare cases, a serious allergic reaction to this drug may occur, so seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, contact your doctor or pharmacist. Remember, it's important to follow your doctor's instructions and report any side effects to your healthcare provider. Before taking Endacof-Dm, it's important to inform your doctor or pharmacist of any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to disclose your medical history, especially if you have breathing problems, diabetes, glaucoma, heart problems, high blood pressure, kidney or liver disease, seizures, stomach/intestinal problems, overactive thyroid, or urination problems. Endacof-Dm may cause dizziness, drowsiness, or blurred vision, and using alcohol or marijuana can intensify these effects. It's advised to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do so safely, and to limit alcoholic beverages. If you are using marijuana, it's important to discuss this with your doctor. This medication may contain aspartame, and if you have phenylketonuria or any other condition that requires you to restrict your intake of aspartame, it's important to consult your doctor or pharmacist regarding the safe use of this medication. Liquid preparations of Endacof-Dm may contain sugar and/or alcohol, so caution is advised if you have diabetes, alcohol dependence, or liver disease. It's important to ask your doctor or pharmacist about the safe use of this product. Before having surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of Endacof-Dm, especially experiencing dizziness, drowsiness, mental/mood changes, constipation, fast heartbeat, trouble urinating, or blood pressure changes. Dizziness, drowsiness, and confusion can increase the risk of falling. Children may also be more sensitive to the side effects of antihistamines, and in young children, this medication may cause agitation/excitement instead of drowsiness. During pregnancy, it's recommended to use this medication only when clearly needed, and to discuss the risks and benefits with your doctor. This medication may also pass into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how Endacof-Dm works in your body or increase your risk of serious side effects. Make sure to keep a list of all the medications and products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without consulting your doctor. Avoid taking certain MAO inhibitors with Endacof-Dm, as it may cause a serious and possibly fatal drug interaction. Your doctor can advise you on when to start or stop taking this medication in relation to MAO inhibitors. Additionally, be cautious of other products that may interact with Endacof-Dm, such as certain antihistamines and products that cause drowsiness, including opioid pain or cough relievers, alcohol, and muscle relaxants. It's also important to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. Furthermore, Endacof-Dm may interfere with certain medical or lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are using this medication. If someone has taken too much Endacof-Dm and experiences severe symptoms such as passing out or difficulty breathing, they should call 911 immediately. Otherwise, they should contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include agitation, confusion, flushing, hallucinations, large pupils, muscle twitching, and seizures. In children, excitement may occur first, followed by loss of coordination, drowsiness, loss of consciousness, and seizures. Always seek medical help if you suspect someone has overdosed on Endacof-Dm. If your doctor has prescribed Endacof-Dm for you, it's important to take it as directed and not to share it with others. Be sure to attend all of your medical and lab appointments as recommended by your healthcare provider. Endacof-Dm is used to relieve symptoms of cough and congestion caused by the common cold, allergies, or other respiratory illnesses. It is important to follow the dosage instructions provided by your doctor or pharmacist. Typically, this medication is taken every 4 to 6 hours as needed for symptom relief. It is best to take Endacof-Dm with a full glass of water to ensure proper absorption. Remember to not exceed the recommended dosage and to not take it more frequently than directed. Always consult your doctor or pharmacist if you have any concerns about the use of this medication. If you forget to take Endacof-Dm on your regular schedule, take it as soon as you remember. But if it's almost time for your next dose, just skip the one you missed. Don't take a double dose to make up for the missed one. Stick to your regular dosing schedule. It's important to store Endacof-Dm at room temperature, away from light and moisture. Liquid forms should not be frozen, and it's essential to keep all medications out of reach of children and pets. When it comes to disposal, don't flush Endacof-Dm down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the product when it's expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.